Hello and welcome to Midlife Moments with Dr G. I'm Dr Georgina Hale, Specialist Medical Doctor and PhD in Midlife Women's Hormones. So today I'm talking about a most embarrassing and very inconvenient aspect of midlife and perimenopause in some women. About 30% of women, perhaps a little more, complain that their menstrual periods get heavier as they're getting into their late 30s, 40s, even before they reach perimenopause. So heavy menstrual bleeding is, there are definitions out there, but basically if you're bleeding for many days, 7 or 8 days during a menstrual period, if you have to change your pads and tampons very regularly, say 1, 2 hourly, 3 hourly, and it's a heavy loss between, or if you have to get up at night to change your pads, tampons, etc. A small percentage of women actually have flooding, and that's when you get sudden blood loss where it just bleeds through pads, tampons, everything. So how much blood do we actually lose during a menstrual period? Well, in my study at least, because there are very few studies on this, the average was around 15 to say 20 mils of pure blood. And you may not know this, but only about 30 to 40% of the menstrual fluid is actually pure blood. So you don't lose as much blood as what it looks like. In my study also, there was 2 women in the perimenopause who lost 150 to 200 mils of blood, and they didn't even have a bleeding disorder. They just had very heavy blood loss, and they had flooding. They were experiencing flooding. So why does this happen at midlife and perimenopause? Well, the studies are scant, but most of them suggest that it's due to an uptick in the estrogen, production of estrogen, because estrogen builds up the endometrium, or the lining of the uterus. And this has to do with the loss of follicles in the ovary, and this causing an increase in follicle stimulating hormone, and it has the effect of increasing estrogen production from the follicles left in the ovary. So what can women do about this? Well, I think it's important for women to know how long their cycles are during the cycle, and how many days they're bleeding, so they can keep an eye on the changes as they go through, so they can take this information to a healthcare provider. It's also really important to know when in the reproductive aging you might, hello, I have a visitor here, when in the reproductive aging you are between midlife and perimenopause and menopause. So I've got in my book the zones. Now the zones are based on the scientific stages of reproductive aging, the straw stages, and it helps you determine how long you may be having this heavy menstrual bleeding, because obviously that doesn't happen once you hit menopause. And I also find it very helpful for women who aren't actually flooding, don't have a blood loss anemia, and don't have any other kinds of issues, health issues because of that, that they can do an anti-inflammatory diet. Because if you have excess inflammation in the body, your heavy menstrual periods may be worse because of the excess inflammation. And I go through a lot of the anti-inflammatory diet principles in section 3 of my book. And it also means de-stressing a lot of the time. Midlife women have a lot of stresses, and we know about them. We've got teenage kids, we've got perhaps a teenage husband, metaphorically, and we've got aging parents, and we've got a lot more responsibility at work. This is Yodi. He obviously wants to say hello, Yodi. This is only really for people who have got manageable but heavy bleeding. And so otherwise, heavy bleeding, really you need to take the problem to your healthcare provider. And obviously there's going to be investigations like ultrasound, MRI, etc., to find out whether you've got any abnormalities in the uterine structure. And then we can decide what procedure or what medicines would be suitable for you. Some of the simple things you can do also is take an anti-inflammatory just during the days of bleeding. And tranexamic acid also is an option for women just to take during the heavy heavy bleeding days during their menstrual period. So I hope that was helpful, and in the comments below please let me know what other subjects you want me to cover. If you've got questions, of course I'll be answering anything anonymously, and I look forward to next time we have a chat. Okay, until next time, see you later.